Appreciate that, Rhino. We are pleased to welcome now Dr. Wanda Stroupe, President, Mississippi Association of Nurse Practitioners and President and CEO of Family Care Clinic of Ripley, and Dr. Carolyn Coleman, Board of Directors for the Mississippi Association of Nurse Practitioners, Central District 2, Assistant Teaching Professor at the University of Southern Mississippi, Program Coordinator for the Psychiatric Mental Health NP Program. Ladies, thanks for coming in.
Thank you.
Thank you.
All right, so what's on your mind these days? You guys have about 7,000 NPs in the state?
Close to 8.
It's close to 8 now. Serve a critical and vital role in the delivery of health care among our state. What are you guys trying to get done in our legislature this coming year?
Well, full practice authority is obviously always first and foremost in our mind, and we are moving toward that as well. Being able to sign off on some orders, some things we haven't been able to in the past, death certificates, those sort of things. So we're working on both of those issues.
Okay. And this is also National Nurse Practitioner Week, correct?
Yes.
Any activities planned for that? Any sort of events or activities or just communications just to call attention to that?
Basically, we're just doing communications right now. We do have a raffle with our membership from the Mississippi Association of Nurse Practitioners. Anybody that joins our organization or the current members can go on, and if you join now to become a member, then you can enter our raffle to win a free conference.
Okay.
For our next year's yearly conference.
So are most of the nurse practitioners, are they a member of your organization, the association?
No, unfortunately not. We have about 10% membership, which is pretty standard for most organizations. So we're close to what's normal, but obviously we would love to have much higher membership. But we
Sure.
do have an active member area across the state of Mississippi.
Tell us a little bit about the scope of authority that NP has, kind of where that stops and where a full physician must come into the picture. I know that's confusing to a lot of people, and that's really been at the heart of extending full practice authority in law to the NP community. Tell us about that.
Well, full practice authority really allows nurse practitioners to practice within the scope of what they're allowed to do. So there's a scope of practice for every entity. Nurse practitioners, physicians, depending on their specialty, have certain things that are within scopes of practice. So what nurse practitioners are asking with full practice authority in the 28 states that already have it is that we're allowed to practice within our scope. So you know the scope of practice that is assigned to you based on your degree. You practice within that scope. Then that basically means that nurse practitioners can diagnose, can treat, and can refer. And like with any physician, there's a specialty, and you refer to a different specialty if that's out of your specialty area. So whether you're a physician or a nurse practitioner, you're going to know what that scope level is. If you're an OBGYN and you have a patient with heart problems, obviously you're going to refer to the cardiologist. And we're in the same way. You treat and diagnose, and when you get to the point where you need the specialist, you refer that patient to the specialist. So you stay within your scope of practice, and that's the request for full practice authority, that we are allowed to practice to our full scope.
Okay.
Without having a contract. Right now, it's required that we contract with the physician to be able to practice.
Okay.
It's not supervision, so they're not supervising us, but we do have to have a contract to be able to go to work. And there's no other occupation that we know of that has to have a contract to be able to go to work. I was talking to Dr. Stroupe earlier today, and I had gotten a phone call from a nurse practitioner last night where her physician license are being suspended. And it has nothing to do with her. She has not done anything wrong, but she's not going to be allowed to work. She's going to have to close her clinic and not work because the physician that she contracts with is being suspended.
I see. Okay, so just the association itself, as required by law through contract, is causing this problem here.
Yes.
So
and those are patients that are not going to be able to be seen. I've had it happen to me, myself personally. On my way to work, I stop and check my mailbox, and there's a letter in my mailbox saying how my collaborator license are being suspended.
Okay.
I didn't know anything about it. Don't know what the collaborator did. Had nothing to do with me. Didn't even work in the same office.
So is it not just simple enough to find another one to contract with?
No, that's not. That's not easy. It's hard.
There are restrictions on, you have to have a like practice. So I'm in family practice, and I see adults in pediatrics, but my collaborators have to be in a like practice. So I couldn't have a surgeon who said, I'll collaborate with you,
I see.
or a cardiologist to collaborate with me. It has to be in a like practice, and they have to be practicing a certain amount of time. They can't be working the ER all the time and you're in clinic. They don't work clinic practice. It has to be similar. And then there's a fee that's associated with that, of course.
Okay. And you want to reform the laws in our state that would not require that?
We do. It's a one-page collaborative agreement that is signed saying that they have to review our charts. And like I said previously, 28 states have had this for years, some of them. And so, of course, the American Nurse Practitioner Association is supportive of this as well. And so we want to reform that law and remove that collaborative agreement. We're not asking to expand our scope of practice. We're asking for that to stay the same because we know when we need to refer, and we're held accountable to that.
What's the pushback on that? I've been in the Capitol before. I've watched those somewhat contentious debates, honestly, in committee meetings. The room is packed. And it's almost divided. You got the NPs on one side, you got the physicians on the other side. They seem to rather strenuously object. What's that all about?
The bottom line is money. It's usually money. There's a cost to those contracts. And if we're removing that contract and that cost, we're taking away some of their income.
So you're paying the physician out of your pocket or out of whatever fees, revenues you receive for the privilege of having that relationship so that you can practice. Is that accurate?
That is absolutely accurate.
Okay. Is that the way it works in other states that require this as well? There's a flow of money between the NP and the physician that they're attached to?
There is, always. And, one interesting thing I've always found is you look at optometrists and ophthalmologists, they don't have that. They don't have the debate over titles. They don't have the debate over whether there's never been a contract between them. And there's a difference there. The optometrist is the physician and the ophthalmologist. I mean, the ophthalmologist is physician and the optometrist is not.
Right.
They've never, in all the years they've been in practice, had an issue. And yet, for us, with physicians, it's always been an issue. And but yes, that money is paid directly from the nurse practitioner. There's no revenue coming in. You pay that from whatever you bring into your clinic. That money is paid back out. And that can be set, that's always set by the physician.
Interesting.
And we've had studies from other states that have full scope practice that the value of care does not decrease.
Well, that's the other thing you hear.
Yeah.
I mean, that's the most common objection you hear is that the NPs don't possess the skills and the years of training and practical experience that the full physician does.
But if you look at other states that have full scope practice, the level of care has not decreased.
And the Veterans Hospital, they have full practice in every state, even in Mississippi.
Oh, I didn't know that.
If you work for the Veterans Hospital, you have full practice already in state.
So
Mississippi.
somewhat exempt from state law in that respect because it's federal?
Yes, because it's federal.
Interesting.
And I believe President Trump changed that his first, if I'm not mistaken, don't quote me on that, but his first term, that was changed at some point there, and they've had it for a while.
Yeah, I know we made lots of reforms concerning care for veterans through the VA and the TRICARE and so forth to allow them greater access to medical resources.
Right,
yeah.
and it's been shown that their level of care has not dropped either.
Okay.
So, and that's right here in Jackson, Mississippi, our VA. They don't require.
So why do you think our legislature won't see fit to reform?
Money is usually the case. It's a lot of issues with money. And now they talk about, education, and education is very important. You know, at no point do we feel like we're physicians or do we try to portray ourselves as physicians. We know our scope of practice, and that's the thing we've really tried to put forth is we're not expanding our scope of practice. We are asking to be allowed to practice within the full scope of practice we have and not have to pay for that privilege and limit our access, because as Carolyn said, 46 nurse practitioners just this week cannot work because of a doctor losing his license.
Got it.
That's a lot of patients.
We got to go, but I got to ask you, are you going to be trying for this again this year?
We will always try for this.
And we'd like to
It will
say
happen.
we would like to say Happy Nurse Practitioner Week to all our nurse practitioners out there listening.
Absolutely.
We appreciate all that do. Dr. Wanda Stroupe, Dr. Carolyn Coleman with the Mississippi Association of Nurse Practitioners have been our guests. Appreciate you ladies for coming in.
Thank you
Thank
for
you.
having us. We appreciate it.
We're coming right back in the Element Wealth studio.